Welcome to day 2 of the Virtual Insurance and Reimbursement Conference, and we are so happy that everyone could make it today. So on behalf of NHF and the Planning Committee, I'd like to welcome our 4 speakers. My name is Marla. I'm the Senior Healthcare and Policy Analyst with the National Hemophilia Foundation. And before we dive into the session, I'd like to thank our sponsors again. They are CSL, Genentech, Grifols, Hemophilia Alliance, Novo Nordisk, Pfizer, Sanofi Genzyme, and Takeda. And at this time, I'd like to kick it off with Mandy, and thank you.
I am so glad to be here with you this afternoon. I'm Mandy Herbert, Director of Program Development for PSI. I've been with them for 15 wonderful years, and we've been within the community for just over 30 years. So again, I'm just happy to be here. I know we're probably all getting a little tired of virtual platforms, but it is a great way to still see each other and interact. Today, I'm going to talk a little bit about PSI and the different programs that we have available for the community. So a few things about PSI. Like I said, we've been around for 30 years. We actually got our start in the bleeding disorders community. We are independent from our donors, and I'm part of the program development team here at PSI, and we're a great team of 4. And we have the pleasure every day of researching the different disease areas that have a need that's not being fulfilled, and then creating those assistance programs. Our board of directors do approve all disease funds, so they're very well informed about the different communities that we support and in alignment with our team and looking for new, exciting ways that we can continue to make the patient whole. All of our patient programs, you can apply for them online, very simple. We'll talk about that a little further in the presentation, but patients are received and the orders come per serve basis. And if a program is at capacity, and you'll be able to see that on our website, it is up front and center on our patient programs page. You can have the option of being joined to a wait list if that's your preference. So I think many of those who are familiar with PSI know that just like the other foundations in this group today, have a big heart and are very passionate about advocacy. So we are proud to be part of United for Charitable Assistance. NHF is part of that group as well. And really, we partner with other organizations with like interests to make sure that we are ensuring patient assistance and availability. So that is always at the front of our minds, and an effort that we very much work towards this year, and we will always be committed. And I do want to say really quickly, congratulations to NHF on the most recent polling survey. I think that the results received really do go to show that patient assistance and copay accumulators, they all still very much are needed, and still are challenges that present that we need to address as a group. And here you'll see that there are over 20 different national patient advocacy organizations who are part of United for Charitable Assistance. And this information is available on our website, as well as these other organizations' websites, if you're interested in learning more. And I won't spend a whole much more time on patient advocacy, but we do have a great team here at PSI. I'm sure that I'm familiar with James Romano, one of my colleagues who I just very look up to and appreciate all of the hard work that he does for the patient communities. But we are always advocating for, again, access, affordability, and really we're here to help the community make voices heard. With advocacy and with financial assistance, we also have a very robust educational platform. And one of my favorite mini video series that we have within that platform is our Patient Access Lounge, or PAL. And prior to COVID, we were all able to get together and do live filmings for our videos where we talk about health insurance topics. So you'll have one upcoming for open enrollment. But with COVID, we're not able to do that anymore. So now we have our little avatar video, which is really a lot of fun to put together, but it's allowing us to still share information with the communities, to still have those actual voices with avatars that look similar to the people who are actually educating the communities. So I invite you to visit our website and check out this Patient Access Lounge series on our education page. And again, we do advertise on social media when we're going to be pushing out new series and new education options. So let's get right to it. We want to know what kind of financial assistance is available to the community. So we're going to take a look at our inherited and acquired factor deficiency programs. Currently, we have this program for both public insured and private insured patients. And the assistance I offer is financial support for your health insurance premium. The deficiencies are all inherited and acquired factor deficiencies, such as hemophilia inhibitors and von Willebrand. And it's important to note that with looking at this program, of course, we do have eligibility criteria. And in regards to income, that would be within the 350% federal poverty level. And one thing I do want to point out, you'll see that our range differs slightly from what the federal government provides. It's a little more generous, and it takes into account extenuating circumstances. So outstanding medical debt, child support, alimony. There's all other types of financial challenges that face our community that prevent us from being able to access and afford our coverage as well as our treatment. Within this program, patients can stay on service for as long as funding is available and as long as they remain eligible for the program. So we will reach out every 2 years to ensure that you still have the proper insurance, you still have income within the allowed range, and nothing has changed with diagnosis, etc. And for this program, you can receive, if approved, up to $11,000 annually. So that's around $917 a month. And I know that we're always looking to see if a fund is available to applicants. As of yesterday, and this remains true as of today, publicly insured disease fund is open and private insured disease fund is at capacity. I will say that as we into the new year, I'm excited to say that we're going to add both travel and ancillary support in 2021. So travel, that's going to help patients with costs of getting to and from the treatment center. With ancillary assistance, that's going to help with assistive devices and also any medication or treatment that helps with the symptoms and side effects of your diagnosis. And I do want to point out here that PSI does request proof of premium every 6 months. We want to make sure there has been no change in the costs that we're supporting the patient with. To be helpful, and we do receive questions, so I thought it would be great to put this into a slide format, defining what we consider to be private insurance versus public insurance. So this slide, and hopefully these presentations can be referred to after today's session, if you have any questions about what these types of insurance would look like within PSI assistance. So another question, what kind of documentation does PSI need to determine eligibility for assistance? So we're going to request proof of household income. That can be your most recent 1040 tax form, W-2 forms, 2 consecutive pay stubs, Social Security letter, or even a food and shelter letter. We also are going to gather what we call a signed medical care provider statement, sometimes it's an MCPS, and that form allows us to connect with your physician and verify that you have the diagnosis that is supported through the program. We can even fax that form to your physician to have it turned and provided back to PSI in a timely manner. Additionally, we're going to go ahead and get proof of insurance. And we need this to confirm your insurance type, whether it's public insurance or private insurance, and also what's the health insurance premium that you are required to pay. And I will say with these forms, you can email those, you can fax them, or you can upload them through your secure patient portal, which leads me to applying for assistance. You can visit our website and you can create a secure patient portal in order to submit application. The application takes 10 minutes. And if you ever have any issues, please give us a call because we can also enter the application on our end on your behalf if you have any issues. And I will say that within our website, practically every page has an apply now feature, so you can easily access the application. For those who are not the patient, So a social worker, for example, we have a guest application that can be accessed 24/7, and it's very quick, same process as a patient goes through, so 10 minutes or less. Within the guest application, before you close out, you will receive real-time confirmation that your referral to the program has been received. Now, if there are questions about an application, whether it's pending, whether it has been approved, that information is solely shared with the patient or their authorized representative. When it comes to reviewing an application, we try to get to it as quickly as possible. And a lot of it has to do with our staff on our end, but also on the person applying on their end. So once we have the information, your application that was received online, we're going to send you an introduction letter and request that required documentation that we just reviewed. Once we have that information, we're going to determine if you are eligible for program support. And I will say that we allow 14 days before we send a reminder. And then at 30 days, we will either have that information in-house to determine eligibility, or at that point in time, if we don't have anything in-house, we do have to close the application. But we will reach out on our end to make sure that we can help you get this information together and get it over to PSI. When it comes to payment options for your health insurance premium, we can provide payment in a few different ways. We can mail a check directly to your insurance company. Now, we all know some will take it, some will not. It's been kind of iffy over the past couple of years. We can reimburse a patient following proof that their premium was paid. We can provide a credit card payment. So this card that you see on your screen, that is provided to patients who are approved for support. And that is loaded monthly. So you can use that card each month to make your premium payment. Additionally, we have an electronic deposit feature for reimbursement patients. So I think of it as a direct deposit. So once we have proof that you have paid your premium, we can actually deposit those funds directly into your bank account. Frequently asked questions, and hopefully these are a few of the questions that you might have today. So how long does it take to be approved? The application process can move very quickly if and when we receive your required documentation. So within 2 days or less. If a program is closed to new applicants, can I join the wait list? Yes, you certainly can. So if you go on the patient programs page and you try to access the application, but it says we're not currently taking applications because we're at capacity, please join our wait list. We will go ahead and once funding becomes available, process your application in the order in which it was received. How much assistance will I receive if approved? And we touched on this prior, but we can assist with up to $11,000 annually. And we encourage you to go ahead throughout the year. Please notify us if you have any change in income or insurance. We want to make sure that we can take care of you and that you're still eligible for program support. How often do I need to reapply for assistance? That's a great question. Any changes in income or insurance should be shared with PSI. So again, we can make sure that you remain eligible. We also want to know if there's any kind of increase in premium so we can make adjustments on that end, that we determine, ask you for required documentation every 2 years to determine eligibility. And is there anything else that I need to do to receive assistance? To ensure that we are assisting with the correct premium amount, we require a copy of your health insurance every 6 months. And this is another program that we offer. It's our Access program. Actually, that office is located in Tampa. PSI is actually in Richmond, Virginia. And we have an attorney at Access, and what they do is advocating for chronic conditions, entitlements, and social services. And we have an attorney there and other experienced staff who help families navigate through federal entitlement programs, such as Social Security disability. The national success rate for getting patients approved for disability right now is 38%. And our team has a 78% success rate. They really are a great group, and they really do go above and beyond for the patient community. They're also available to help with just general questions regarding health insurance, and also have a free legal hotline. So you can call that if you have questions about COBRA, workers' comp, etc. We really do encourage the community to reach out to and ask them those questions and see if they can help you if you're having any challenges with disability. So I know I've covered a lot, and I'm sure there'll be time for Q&A, but again, just so appreciative to be here and be part of this great group. I think altogether our knowledge can really help make the community whole.
Great, thank you, Mandy. My name is Allison Harrison, and I am going to be talking to you about HFA's Helping Hands program. I am the program manager for Hemophilia Federation of America's Helping Hands program. I think most of you probably know HFA was founded in 1994, and we are a national nonprofit organization that assists, educates, and advocates for the bleeding disorders community. And the Helping Hands program was founded in 1997, and we help provide financial assistance and other support for our bleeding disorders families. The best place for anyone to start to find out information about Helping Hands is to go to our website. We have a short link here that you can follow. And if you don't find the answers to your questions on our web pages, please feel free to use this email address to reach out. This email goes to the three of us on the Helping Hands team, and so we can make sure to answer your question as soon as possible. Right now, all of our financial assistance programs are open. I will be talking about details for our three core Helping Hands programs: emergency assistance, items assistance, and inhibitor support. We also manage the disaster relief program that was started in 2004 for community members experiencing natural disasters, as well as our COVID-19 relief program that was started in March. Across those programs, there are a couple of criteria that apply. Households must have an individual with an eligible bleeding disorder. We have a list of those bleeding disorders on our website, but they include hemophilia A, hemophilia B, von Willebrand, various factor deficiencies, and platelet disorders. So a household applicant needs to either have that bleeding disorder or live in a household with someone who does. And they need to reside in the US or a US territory. I'll also be sharing briefly about our Helping Forward program, as well as resources we provide on our patient assistance portal. We are really committed to connecting every applicant, not only with financial assistance, but with other resources for financial help, education support, and just community support as well. I wanted to make sure that all of you on this call know what a critical role that you play in connecting community members with resources. You are all eligible referrers to our program, and I believe that referring a community member to Helping Hands or to any of these wonderful organizations on this call can really make a ripple effect in their lives. For example, our new COVID relief program, 243 households referred to that program are brand new to HFA. So that means there are 243 families who now know about their local bleeding disorder organization, about local financial help, about national support programs. So it really does make a difference. So keep sending families our way. For quick questions about our core Helping Hands programs, I encourage you to check out this PDF. It's on our Helping Hands landing page, and it gives you a really clear overview of those three programs and what you need to know to refer folks to them. All right, I'm going to dive into some details here on our COVID-19 relief program. This program provides financial relief to members of the bleeding disorders community who are grappling with a significant loss of income due to COVID-19 and have an urgent need for help with an essential household bill. That could be mortgage, rent, electricity, water, natural gas, phone, or a car payment. Applicants cannot self-refer to this program. We ask for an eligible referrer to submit a referral on our website for them. That helps us save time and be able to go ahead and connect directly with that applicant instead of asking for additional medical verification. So the program guidelines, some of you may have heard about this program earlier this spring. We've revised our guidelines slightly. So now each qualifying household can receive up to $750 from the program, not limited to one bill. So for folks who need help with several bills and they're less than $750, we may be able to pay multiple bills for them. Once they're referred, we call the applicant and we complete a brief application over the phone. And in most cases, we're able to make an eligibility determination on that call so that we make it a really quick and easy process for folks who are in crisis during the pandemic. If approved, we pay funds directly toward the bill. So that's our COVID-19 relief program. I know there are questions about whether to go to COVID-19 or to emergency assistance. And what I'd recommend to you as referrers is to look at where the financial need is mostly stemming from. Is it lost income, COVID-19, or is it unrelated to COVID-19? And for those cases, we have emergency assistance, which can cover one bill related to housing, utilities, or transportation. For this program, we allow one application per 365 days, whether the application was approved or denied. And the focus of this program is financial hardship that was caused by or majorly impacting the bleeding disorder. Again, we require a professional referrer so that we can call that applicant within 5 days and get the process started. Applications are submitted anonymously to a committee that makes a decision about approval. And if approved, again, we pay directly to the company or the landlord. So all we need from the applicant is that phone call with us and a copy of the bill. Our items assistance, I love this picture and this program. This is for durable medical items like protective gear, mobility supports, braces, cooling supplies. We have a list of examples of these items on the webpage, so you can check that out. People can refer themselves or be referred by a professional. We just require some verification that the item is related to the treatment of the bleeding disorder or recommended by a bleeding disorder professional. And we have a form online that you can use to make it really easy to fill that out. If approved, we can provide either reimbursement for the purchase of the item, or if the person is not able to afford that out of pocket to be reimbursed, we can make an upfront payment for them. And households can apply multiple times throughout the year. We know, especially with kids, needs change throughout the year. Someone may outgrow their comfy cap and then need to get some knee pads because they're crawling. So happy to support that through our items program. We have a special program for people with active inhibitors because we know that it can be very costly to get to medical appointments, or if you need a tutor because you've missed a lot of school related to your inhibitor. And there are special considerations for fitness support and protecting joints. So this program is only open to those with an active inhibitor. Again, we do have forms online that can be filled out to help support medical travel, educational support, or fitness support. Again, we can do reimbursement or we can pay up front if needed, and families can apply multiple times throughout the year. Our disaster relief program is to provide really quick, rapid relief for families impacted by natural disasters like tornadoes, hurricanes, floods, wildfires. It seems that there's no end to these natural disasters, especially this year. People can refer themselves on our website or be referred. We also try to proactively reach out to local bleeding disorder organizations when a disaster occurs to make sure that we can be in touch with families who need help. either with essential household supplies or covering the cost of repairs. And we have a webpage for this program with more details. Wrapping up, I just want to make sure that you know about some additional resources, because we know that just funding isn't all that our families need. We have a patient assistance portal with information that we update regularly about financial assistance resources, hepatitis C and HIV specific resources, manufacturer assistance programs, and mental health resources. These are in easy to navigate PDFs that people can click through hyperlinks, or they can print it out and share it with someone. HFA also still is updating our COVID-19 hub with COVID specific information. And I really am excited to share our Helping Forward program. This was created out of the stories that we've been hearing for more than 2 decades about financial need, and we want to address the root causes of financial need by helping bleeding disorders families with financial planning and career planning. So please check out our Helping Forward website, share it with your patients and community members, and encourage them to sign up. We hope to have more coming soon on this front. So definitely something to watch. And because this is an insurance conference, I would be remiss if I did not mention Project Calls. HFA wants to hear the stories of your insurance frustrations, and you all on this webinar can get permission from your community members to be a proxy and fill out the Project Calls form for them. So please visit projectcalls.org. And there's a 5-minute version of this survey to share your insurance concerns so we can better advocate for them. I won't go into all the details about what else HFA does, but I hope that you will share our support and education and research programs with your community and sign up for our emails so that you find out about even more resources that we'll be adding soon. Thank you.
Thanks so much, Allison. That was so great to learn about HFA's program and especially what Helping Hand can do. My name is Aisha Azam, and I'm with the Patient Access Network Foundation. It's so great to be here today with all of you. I'm really excited to be able to talk about our resources and also hear from you to understand what questions you have and what you're facing today. Thanks very much to the National Hemophilia Foundation for putting on this important event. So often insurance issues are something that we're dealing with in our everyday, but it's very hard to find the time to really get ahead of them. And so thank you for bringing this important topic to light. The Patient Access Network Foundation is a nonprofit that provides assistance to people who have health insurance, but who still have concerns in paying for their out-of-pocket costs. In addition, a big focus of what we do is advocating for improved access and affordability to make sure that patients' costs are affordable across the board so they can focus on their health and not have to worry about these other barriers. We have been around since 2004, and specifically our hemophilia programs have been around for the last few years. Within the hemophilia space, we have 2 programs that we offer. One is for copay assistance and one is for premium assistance. The copay assistance program covers deductibles, copays, and coinsurance for the medications covered by PAN. What we cover is all medications that are indicated for hemophilia by the FDA, as well as those drugs that are recommended by guidelines or other compendia. When you receive assistance in our program, it's for 12 months. So if you were to enroll today on behalf of your patient, that assistance would be valid until October 27th of next year. We also offer a 90-day look-back period. So what that means is if you enroll today and your patients had expenses for the last 90 days, you'd be able to seek reimbursement for those as well to make sure they're covered within the grant. The amount of assistance we award within the copay program is $2,900. This is something that we review on an annual basis, and so I'd recommend if you have patients in this program who are looking for assistance and you contact us next year, that you take a quick look to see if that number has changed. We recognize that There was no one-size-fits-all solution. So if your patient does find that they need more funding beyond the $2,900, once they use that and if a fund is still open, they are able to apply for a second grant for additional funding to support their out-of-pocket costs. In addition to the copay assistance program, we have a premium assistance program. It's important to note that your patients may apply for both programs if they need assistance, but they must fill out a separate application for each one, and the application process is the same. Anyone enrolled in the Premium Assistance Program can get premium assistance for one or more of the health plans, and it's covering for the out-of-pocket cost share. Just like with our copay assistance, the assistance is for 12 months and that 90-day look-back period still applies. So if they have expenses or premium payments that are perhaps delayed, we are able to help out if it's needed. The amount of assistance provided is $4,500, and again, this is for 12 months. Who qualifies for assistance? So we require anyone who enrolls with PAN in the hemophilia programs to have a diagnosis of hemophilia and to be receiving treatment for this condition. We require them to reside and receive treatment in the US, but citizenship is not a requirement. And we require them to have health insurance. Whether it's public or private, it does not matter to us for this specific program so long as they do have health insurance coverage. Their medication or the product they're seeking assistance for must be listed on our list of covered medications, which can be found on our website, and the income must fall at or below 400% of the federal poverty level. If you have any questions, we definitely recommend that you contact us, or if your patient's situation if your patient has extenuating circumstances, it's always best to give us a call. You can find out if you're eligible really quickly for this program. In order to apply, the first thing to do is check if the disease fund is open. You can do this in a few ways. You could go to our website at panfoundation.org, where you can also see the eligibility criteria and the list of medications. Or you could go online to our patient portal if you are helping your patients apply. However, if you are a healthcare provider or pharmacy, we have our own portals that are designated specifically for you. So you can go on there and check. Right now, the hemophilia programs are open. And so if you are looking for assistance, you can go ahead and apply. However, if the program is closed at any point in the year, you can sign up for a disease fund waitlist to receive notification when the fund does open and apply then if assistance is still needed. It's important to note that while patients can apply on behalf of themselves, although caregivers can, providers or pharmacies can also apply on behalf of patients, being able to support them and make sure that they're set up with everything they need. The information that we require is mostly about the basics. We want to make sure we know the patient's demographic information, what medication they're taking, and their household size and income. And that information can be submitted in an application to us either online through the patient portal URL below or through any of our portals, or you could give us a call and submit it through our call center. The applications are processed in real time, so a decision is provided immediately. And if you are receiving copay assistance, that assistance can be used on the same day. If you're receiving premium assistance, we'll work with your patient to make sure that payment is sent directly to the insurance company whenever possible. And if not, we'll make sure that the patients are reimbursed for their expenses. We also have a program available for financial support specifically for COVID. This program is currently closed, but the disease fund waitlist is available. So what that means is if you are looking for assistance and unable to find it elsewhere, you can sign up for the program and receive notification when the program opens so that you can submit an application. This program will award patients who are eligible with a $300 grant available for basic living expenses and medical care. Most commonly, since the program's inception back in April, we've seen this grant mostly used for transportation expenses and food. There are so many great organizations that have come up with fantastic programs during COVID. And so on our website, we have a directory of COVID programs as well. And so these are lots of organizations who have come up with direct financial support programs or referrals to other programs. So definitely check it out if your patients need assistance or you're looking for anything to help them. Another great tool that might be valuable to learn when programs open and close throughout the year is FundFinder. FundFinder is the free web app developed by the PAN Foundation where it crawls the websites of different foundations to pull in information about program status. Often, programs can open and close so quickly that it's hard to be able to find assistance. So through FundFinder, you can sign up for text or email alerts to learn exactly when programs open so you can help patients or let your patients know as soon as possible. You can sign up on fundfinder.org. I've touched a lot about the hemophilia programs, but I wanted to be sure to talk about other programs as well. PAN has over 70 disease-specific programs across life-threatening, chronic, and rare diseases. Specifically for the bleeding disorder community, we currently do not have a von Willebrand disease fund, but a common question we get is that many times patients' medications are covered within the hemophilia disease fund. This is because we do cover products that are listed on compendia or guidelines that are recommended for hemophilia as well, and we recognize those overlap. We'd encourage that if you have any questions or suggestions to reach out to us and let us know so we can help as much as possible. And that's why we're here to help. So if you do have any questions, please feel free to apply online or contact me directly. My contact information is listed on the screen, and we'll be happy to help. Thanks so much for your time. And with that, I'll turn it over to Gerald to tell us about the assistance fund.
Great, thank you, Aisha, and welcome everyone. Again, thank you to Marla and the National Hemophilia Foundation for putting this on. I'm very happy to be here and share the great things we're doing at the Assistance Fund. All right, so again, welcome everyone. So my name is Gerald Laurie. I'm the Vice President of Business Development and Strategy at the Assistance Fund. And very, again, excited to be here. Obviously, patient access programs are critical to help patients with various diseases, especially hemophilia, live longer, happier lives and creating that access, and especially during a global pandemic that we're still in the midst of. So our vision is to see the day when no person goes without treatment due to inability to pay. Obviously, this is very utopian pie in the sky, but that's what our mission is each and every day. I know when I'd say when I get up and head to the airport, but now when I get up and come down to my basement each and every day, that is what's in the forefront of my mind, the patients and how we can help, again, create access. Our mission is to provide underinsured people living with life-threatening, chronic, and rare diseases access to critical treatment through, of course, financial assistance, education, and advocacy as well. So these are disease programs. You don't really have to, this is just to show you how many we have. So currently we have 72 disease state funds, and we're looking at a few more. So if you see, there's a lot of rare disease, a lot of oncology, a lot of autoimmune. So I know people may be suffering or dealing with other diseases. So we do have many, many diseases, and we're looking to add several more. One of the diseases, number 11, you can see is COVID. So before we get into our hemophilia fund, so we did establish a COVID-19 fund that specifically helps with health insurance. And what that is we offer up to $5,000 in health insurance coverage for the patients. And again, that is if a patient in any of our disease funds happens to lose their insurance due to COVID, in particular, more than likely a loss of a job, and they need to get insurance coverage to be able to access their therapy. So we opened in March, I think, when I forget when it all happened, but I think March 13th was the day when we realized that we could be in for a while here. And I know we were going through December 31st, so patients are covered through December 31st. We're going to have to reconvene. I thought the pandemic would be over, so we don't know what we're doing for 2021, full transparency, but obviously the need looks like it will still be there, so we'll have to assess that. So with our program types in our various disease funds, we offer 3 programs. One is copay insurance, and this copay assistance, and this includes the copayment, the co-insurance, or the deductible. All of our disease state funds do cover copay, but we do offer 2 other types. One is premium assistance, so we help with health insurance premium. And again, that's good, a Medigap policy if you're a Medicare beneficiary or if you're a Medicaid patient and you want to get a supplemental commercial policy, we do offer that. And then the third one is incidental medical expenses. And this is a whole potpourri of, infusion costs, nursing services, genetic testing, travel. We're seeing, with the advent of gene therapies, cell and gene therapies now, travel has become a significant barrier to access. In particular, for our hemophilia fund, it does offer all three. And our hemophilia includes hemophilia A, hemophilia B. Unfortunately, we do not have a von Willebrand disease yet, but I am always looking. So our enrollment is very simple. You just go to taftcares.org, click on apply for assistance or covered diseases, and then you will see our all the diseases on the screen. You can click hemophilia. Each of our funds also have their own individual numbers. So if you're old school like me, you can simply call up, get a patient advocate, and enroll. It's a very quick process. If you go online, it takes no more than 5 minutes. And once you're enrolled into the program, your approval is instantaneous. And we do cover you for the calendar year. So we do 12-month re-enrollment. Our eligibility criteria is you need to be a U.S. resident receiving treatment in the United States. Our income is multiple of FPL. We actually tend to be a little bit generous here. We are 700% of the federal poverty limit. And truth be told, we do realize these medications are very expensive. They're amazing, but they are expensive. And you could be, making a very nice income. And if you get diagnosed with one of these diseases, it could wipe you out. So 700% may seem like a lot, but full transparency, we're trying to even increase that if possible. But obviously there's many things that we have to go through to get that done. Our diagnosis is you must be diagnosed with the disease. So we do not do any off-label as well with the FDA medication. So it's specifically FDA-approved medications for the disease. And you must have insurance. So there must be some underlying coverage benefit. But again, if you don't have any insurance, and specifically if you come into hemophilia, you can be in the process of attaining insurance, and then we'll pay for your insurance, and then you can come in and get the copayment help as well. And then with our disease program, the fund obviously must be open. If the fund is not open, where in the past we would have our patient advocates mention, please call back later in the month. We do have a new wait list that we launched earlier this year. So you need to enroll into our wait list. And then the nice thing is once we receive funding, we will go through the wait list before we open the fund to new patients. And we can do that either, we notify you via email, text, or phone call to see if you still need assistance. And if you do, you will be enrolled in the program. You don't need to fill out another application. If you do not need assistance, that's great. And then we just move on to the next person. So we currently are not open. Again, my title is business development. So I do the fundraising. So I'm aware we are not open. We have not been open as much as I would have liked, but it's we're still helping a lot of patients. So my goal is to still continue to fundraise. And I do not think, because right now we are at the end of the year, I don't think we're going to open again, but obviously definitely expect to open in 2021 and try to stay open as often and as long as we can. And again, we're 12 months. So if a patient enrolls, let's say January 2nd, they're good through December 31st. But again, if you do enroll in Q4, we do a re-enrollment. So what happens is we do a re-enrollment in November and December. So patients who are currently active on our fund will get notifications with re-enrollment. We bombard people with text, email. If you go onto our website, we'll talk about, there'll be a banner for 2021 re-enrollment. So our goal is to make sure nobody falls through the cracks. We want to make sure that every patient in our program has an opportunity to be in the program for the next year. So we've had some patients in our funds for programs that have been around for 10 years. So they fill out the re-enrollment process and then they're good to go for the following year, granted there is funding. So if we do have a fund that is currently open in Q4, we're obviously not going to enroll them for only a month or two. They're re-enrolled for the following year. So if any patient enrolls today, their claims are paid through December 31st of 2021, the following year. So in essence, they're enrolling for up to 15 months. That is it. Thank you.
Awesome. Thank you guys so much for your excellent presentations. So is PAN considering expanding copay assistance for inherited platelet disorders because the significant need due to the high cost of Amicar?
Yeah, that's a great question. And I think the root of the question of are we expanding programs, are we adding more programs is such a great one because it's really what we're trying to do. We would love to be able to offer additional programs in addition to the hemophilia program to be able to supplement and support the bleeding disorder community. And it's not something that I have any news to share on right now, but what I would recommend is two things. One is I would recommend if you're within the community to be vocal about your support to organizations like all of us and also to others, make sure that you're expressing what the need is for your patients so that collectively we can come together and be able to provide that support. The second thing I'd recommend is to make sure that you are make sure that you are submitting the exact name of the program or disease state rather that you're looking for assistance for to different foundations. On PAN's website, we have a place where if your patient's disease or medication is not covered, you can submit that to us and it will allow us to more directly look into it and let you know about if there's anything we can do. But unfortunately, at this time, that's not that specific program is not active or available for enrollment.
Okay, and then so for the PAN COVID Assistance Fund, do they get a prepaid debit card or how can they access funds if they are awarded?
Yeah, that's a great question. So that the COVID program, the grants is administered through a debit card. And so patients who are eligible and receive assistance will receive a prepaid code mailed to them. They can activate it online or by calling us, and then they can use the expense for what they need. And if they have any concerns, like let's say they use it at a grocery store and it's denied for some reason, they can definitely contact us and we can work with them to make sure that those expenses are paid.
Okay, and one more, is there a time limit to the age of the copay expense owed to apply for assistance?
If I understood that question correctly, so there's no age limit for the hemophilia assistance program. So someone of any age may apply for assistance. Once you receive assistance, the assistance is good for 12 months. And then after that, if additional assistance is needed for a longer period of time, you can renew your assistance by just repeating the application cycle.
I think this is open to anybody, but if the claim is old, can they still apply for aid?
Yeah, so specifically for PAN, it can be applied if the claim was within the last 90 days from when they enroll. So if they were to enroll today, as long as the claim is within the last 90 days, we will honor it and make sure that we get it paid. Beyond 90 days, we're happy to review on a case-by-case basis.
So at the Assistance Fund, we actually look back the entire year. So if you enroll in a program on December 31st and you have a significant bill from a specialty pharmacy, we will do a look back and cover that once you're in the program, as long as the program was implemented effective January 1st. So an example is if, let's say, we open a fund on July 1st and someone has an outstanding bill from January 1st to June 30th, we will not. If we've had the fund established on January 1st, we will look back as far as January 1st. And I did want to mention, I apologize, because, I just see, I feel like I'm at the Oscars and sometimes they're waving, with the time limits. Our fund at the Assistance Fund, all of our funds, the insurance is government as well as commercial. And in terms of grants, we do not have grant limits. So when a patient comes into our fund, they are covered for the year. So we do not do a grant limit. So their out of pocket could be, a few $100s up to several $1,000s. So we do not have grant limits. So I apologize for not mentioning that earlier.
And just for clarification, someone's asking if PAN and the Assistance Fund both have a 90-day look back, or I believe it's just PAN that has a 90-day, right?
We will look back the entire year as long as that our fund was established effective January 1st. Like I said, if our fund was established July 1st, we'll go back from December 31st to July 1st. So we go back as far as we had a fund, if that makes sense.
That absolutely makes sense. And with that, I would like to take the time to thank our speakers very, very much, because I know our community appreciates all of you and all of these programs, and the dedicated time that you guys pay to this issue is really admirable, and we really, really appreciate and support all of you. So from our community to you guys, we thank you, and I will end this session, and then you will be rolled over for the next one. Thank you guys.
Great. Thank you.
Thank you.